The CDC has, are you ready, identified a possible safety concern for some people who received Pfizer's COVID shot. They say the vaccine could be linked to increased strokes in those who are aged 65 and up. Dr. Marc Siegel joins us now. Doctor, a lot to get through with you. But in terms of this warning about vaccination and the increased risk of stroke, that's just for the Pfizer shot or for the Moderna one as well?
Morning, Lauren. It's just for the Pfizer shot, and it's for the first 21 days after getting the shot in the age of 65 or older. They showed what's called a signal, an increased incidence of stroke. They didn't find that with Medicare data. They didn't find it with VA data. They didn't find it in the United Kingdom or Israel, or even with that self-reporting system called VAERS that everyone talks about. Didn't find it. It doesn't mean it's not real. This is the vaccine data safety link, which they take very seriously. Now they're going to try to investigate it over the next couple of weeks, and then the FDA advisory committee will meet on it to see whether it's a real association or not. In the meantime, it's a problem because those over 65 are a high-risk group by definition, and they're the group that we've been trying to get to take vaccines if they haven't had a vaccine in 6 months or if they haven't had COVID. So especially if they're diabetic or have other underlying health problems. So we have other alternatives like Moderna, like Novavax that we can offer in the meantime if people are saying, hey, I want to wait and see what this ends up showing.
Excuse my ignorance here, doctor, but that warning was for, is it for the booster too, or just for the initial 2 shots of the mRNA vaccine?
It's only for the bivalent booster. They never found that with the original monovalent shot. It's not like looking back over the last 2 years, oh, I got that. It's only 21 days after getting this bivalent, and we don't know if it's real or not yet. That's what they're trying to figure out.
It seems like we don't know anything. Okay, next one for you, doctor. New York City health officials
we know a lot.
Are warning a new coronavirus variant could be more likely to infect people who have been vaccinated. I mean, what's the point of getting vaccinated right now, doctor?
Well, again, I think that it's been shown that those who are high risk or over the age of 65 or have underlying health conditions, it decreases their risk of hospitalization. I don't believe that study is really correct, that if you have been vaccinated, you're less likely, you're more likely to get COVID. I think that's a numbers game. How many people have been vaccinated? I think what the real message here is that the new subvariant is very, very contagious. We're underestimating it greatly. It's generally mild. So if you have been vaccinated or you had recent COVID or I give you Paxlovid, you're not going to end up in the hospital. You're not going to end up in the ICU. We haven't messaged that enough, that this is a milder version of the virus that we're looking at now, one that we're getting more likely to live with, but we have tools to fight it.
A Washington Post columnist, Dr. Leana Wen, admits, doctor, that there's been overcounting of COVID deaths and hospitalizations right here in the U.S. She says that's a problem. What do you say?
I say that we've been talking about that on this show for 2 years now, and the Washington Post is finally waking up to it. That's not a surprise. It's not really a headline, because when you go into the hospital and you get tested and you have COVID, you may actually be there for something else, or maybe the COVID is contributing to the problem. Maybe you end up getting severely ill from heart disease, and we don't know what role that COVID actually plays. I'll tell you one thing.
One second, doctor. That's recorded then as a COVID death? Is that then recorded if you're in the hospital for multiple reasons and you die? Is that recorded here in the U.S. as a COVID death or a stroke death?
Well, look, it shouldn't be. Let's be clear. If you have a cardiac arrest, that's your cause of death. If you have a respiratory arrest, that's your cause of death. I think that the point that's being brought up here is maybe they're listing COVID as the primary cause of death, and they shouldn't be. But I know for a long time now that not as many people are ending up in the ICU from COVID, period. Not as many people are ending up on the ventilator from COVID, period. But it's not something I pay no attention to. It's a contributing factor. That's the point. This isn't news. It may be news for the Washington Post. It's not news for us here. On
the flip side, Dr. Siegel, China has reported nearly 60,000 COVID-related deaths. That's since the beginning of December alone. I mean, do you think that's a big number or not? I mean, they record it as if you're in the hospital and you have COVID and something else. they record that, I believe, as something else. So they're not capturing all their COVID deaths. It's quite the opposite.
Right. They have the opposite problem. And they have the opposite problem, right? Where nothing is COVID, where 5,000 deaths from the whole pandemic, where you can't believe a word coming out of China, right? COVID lockdowns, COVID zero didn't work. Now they open everything up and everybody's getting infected all at once. The only thing you can actually believe coming out of China is some photo that shows people looking very sick, rushing into the hospital or lining up outside. It's an absolute mess over there. The thing we're worried about is if a new variant emerges, complete new variant, we're never even going to know about it. We don't know the truth about what's happening in China, and COVID zero was an incredibly dumb policy that should never have been invoked anywhere.
And now the U-turn, and now the Lunar New Year is upon us, and 2 billion plus trips are going to be happening from the city centers where they have hospitals to the rural parts, so Chinese can see their families, which they haven't seen in years, and the numbers are going to get even worse. Dr. Siegel, good to see you. Thank you very much.
Great to see you.